today I'm going to talk about something that is, I believe, rarely spoken about in the tinnitus space, and that is grief. So what has grief got to do with tinnitus? In my opinion, and from what I see every single week, it has a lot to do with tinnitus, and particularly with tinnitus rehabilitation. And I do recommend that any therapist and any practitioner that is in the tinnitus space and deals with rehabilitation of tinnitus, that they learn about the process of grief and how to support someone who is in the stage of grief or in the various stages of grief, which are many. So how does grief present in someone with tinnitus? Well, firstly, grief is not just applicable to someone who has experienced the death of a loved one or someone close. Physical death itself on its own, that is one aspect of grief. When we have the death or the ending of something significant in our lives, that also is classified as grief, and it can be significant because it is in fact life altering and oftentimes a sudden change in one's self, in how someone perceives their future and definitely their present, and sometimes how they see their past as well. Typically, when someone experiences tinnitus, they not only experience stress over something that is confusing and oftentimes has an unidentifiable source straight away, they also are experiencing a loss of identity, a loss of their future or what they envisioned for their future, and they are in fact grieving all of the above. Okay, they're grieving who they once were, their persona. Sometimes they aren't unable to work in the job that they've had, and they have to leave their job if their distress levels are really high. And I see a lot of these cases